As Mayor Bill de Blasio appears all but certain to win a second term, the biggest public health challenge he is likely to confront during the next 4 years will be the stability and viability of health hospitals. The perennially cash-strapped public hospital system was built for a different era and has bedeviled city mayors in hard times and good. With the advent of Obamacare and an expansion in treatment options for lower-income residents, the system of last resort has seen a decline in revenue, leaving it with most of the city's uninsured and underinsured patients. The Trump administration's talk of Medicaid cuts has exacerbated fears over the system's prospects. Story continued below. De Blasio's efforts thus far have done little to staunch the bleeding. In January 2016, the mayor announced that New York City was making a $337 million unplanned emergency investment into NYC health hospitals. The money, drawn from city taxpayers, helped alleviate an immediate cash crunch and came with a promise the city would soon hire consultants to deal with the public hospital's long-term financial problems. The consultant, Manat Health, produced a 56-page report in April 2016, which did not bear the consultant's name and was full of recycled ideas. It cost $3 million. Most of its recommendations have not yet been heeded. 1 month later, health hospitals suffered through an embarrassing budget hearing during which top officials admitted the revenue projections were placeholders. In July 2016, health hospitals approved a second consulting contract, this one for $3.65 million with the Boston Consulting Group. That was followed by a Blue Ribbon Commission, which produced yet another report earlier this year. All coincided with a 5-year plan implemented by then CEO Ram Raju meant to turn the system's finances around by 2020. Through all the reports, consultants and pronouncements, the underlying finances of health hospitals have not improved. The system faces a $1.8 billion deficit in 2019 and $1.9 billion deficit in 2020. And unlike when de Blasio's term began in 2014, he is likely to receive neither sympathy nor cash from Washington, where Republicans have repeatedly tried to cut Medicaid, the main revenue source for health hospitals. He is also unlikely to court much sympathy from Albany due, in part, to his ongoing feud with Gov. Andrew Cuomo, but also because the Republican-controlled state Senate represents upstate New York and Long Island, areas that have their own struggling hospitals and are not keen to tilt the financial scales in the city's favor. There is much more of an awareness and a focus now that things are getting worse, and that was before a Trump presidency, said outgoing health hospitals CEO Stan Brezhnev. There is a recognition that unless there is a dramatic change, the trend lines are going to overcome us and create these enormous deficits that would be beyond the ability of a local government to bear. Health Hospitals has 11 of the city's 47 hospitals and 20.5% of the city's staffed beds. But it accounts for 16.7% of patient days and only 11.3% of patient revenue. The de Blasio administration has significantly increased the city subsidy to health hospitals. When the mayor took office in 2014, health hospitals had been receiving roughly $1.3 billion from the city. It is budgeted to receive $1.8 billion this fiscal year and expected to receive $2 billion in 2020. Apples-to-apples comparisons over the decades are hard to make because the responsibilities of health hospitals have shifted over time, but as a point of reference, consider that the city this fiscal year will provide a direct subsidy equal to about 9% of the public system's revenue. It was a little more than 2% in the late 1990s under Mayor Rudy Giuliani. As long as the city is flush with cash, the de Blasio administration faces no immediate crisis. But the mayor has admitted that the economic bounty he presided over during his first term won't last forever. Couple that with expected federal cuts and there is a looming crisis, said Charles Brecker, senior advisor for health policy at the Citizens Budget Commission. I think the magnitude of the gap will be more than the city can handle without some significant expenditure adjustment, he said. Accelerating financial trouble. If it feels like that is a common refrain, it's because health hospitals has been in financial trouble for most of its existence. CEOs for the last 20 years have talked about doing more to compete for patients, but no one has really succeeded. Every couple of years, there is a comptroller's report warning of the growing deficit, but it continues to grow. Layoffs seem to forever loom but only occasionally occur. And the problems have been growing faster over the last decade, despite a reign of competent, scandal-free management. In 2012, the Citizens Budget Commission issued a report entitled A Troubling Prognosis for HHC's Finances, which explored the fiscal challenges ahead. By 2013, KPMG, Health Hospitals' financial auditor, wondered how long the system could remain a going concern and said health hospitals was in a dire fiscal situation. With Trump in the White House, there is renewed fear that federal cuts to health care could be the death knell for the struggling system. I think the mayor and his team recognize that the future is presenting a grim possibility, Bresinoff said. The $8 billion system, comprised of 11 acute care hospitals, 5 long-term care facilities and more than 70 community-based clinics, serves 1.2 million New Yorkers every year, about a third of whom are uninsured. That percentage hasn't really budged despite the implementation of the Affordable Care Act, which has cut the state's uninsured rate in half. The city's large undocumented immigrant population, ineligible for health insurance under Obamacare, still flocks to health hospitals, which accounted for half of all uninsured inpatient discharges and 80% of uninsured hospital clinic visits, according to a report from the New York State Nurses Association. Part of the Affordable Care Act was paid for with cuts to the disproportionate share hospital program, as the law's creators assumed there would be less need for federal aid when more people had health insurance. The problem is that many of the newly insured took their business to the city's academic medical centers, leaving health hospitals with fewer patients, less revenue and a loss of federal aid. New York is expected to lose $329 million in DSH funding over the next 12 months, the prospect of which already caused a fight between Bresinoff and Gov. Andrew Cuomo. Because of how current law apportions charity care dollars, the vast majority of New York's cut falls on health hospitals. The city has been pushing to change that law for several years but has never succeeded. At the same time, state officials pushed to move Medicaid away from a fee-for-service model toward a value-based payment model, which relies on population health. That helped make Medicaid patients more attractive to the city's academic medical centers, which are, more than ever before, competing with health hospitals for patients. And they are winning. While other major hospital systems saw a 5% increase, health hospitals experienced a 3% decline, according to the Manat report. One of Ram Raj's goals, part of his vision for 2020, was to increase the number of patients health hospitals sees to 2 million, a 43% increase. The idea was to grow revenue, but it never happened. Instead, inpatient utilization has continued to decline, falling 5% during the most recent fiscal year. Ambulatory care is down 7.5%. As health hospitals lost patient revenue, it was also losing federal help in the form of upper payment level, or UPL, payments from the federal government. UPL is a federal program that made up for the difference between what Medicaid paid and the cost of care. The problem is it only pays for fee-for-service Medicaid, which declined as the state pushed insurers and providers into a managed care model. So once again, health hospitals was taking a revenue hit on both ends and losing Medicaid patients to larger health systems while also losing federal dollars. Bresinoff said targeting growth in certain communities is possible. That's part of why the city is investing in new community centers in Bedford and Clifton and refurbishing community centers in Bushwick, Crown Heights, Brownsville, Tremont and Jackson Heights. I'm not looking for the public hospitals to be the Mayo Clinic, Bresinoff said. I'm looking for the ability to provide levels of particularized tertiary care. Improved quality can help the system attract and retain Medicaid patients, but overall growth in patients is not the answer, he said. So, what is the personnel problem? More than 70% of health hospitals' expenses are in personnel. De Blasio has repeatedly said he won't lay anyone off, though that statement has been amended twice, first to exclude management and then to exclude affiliated physicians. Bresinoff has touted a workforce reduction plan that has, over the last 2 years, reduced the number of full-time equivalent employees to 40,000, a reduction of about 8%. That's still 2,000 more than when de Blasio took office in 2014. Attrition will continue, but it's an open question as to whether that will be enough. You can do something with attrition, but you kind of wonder whether they can get the magnitude of savings you need through attrition, said Brecker, of the CBC. Often, headcount follows bed count, at least that's what economics typically dictates should happen. Years of declining utilization at health hospitals. 11 hospitals means they are all now operating below the national industry standard rate of 85% occupancy, according to the Blue Ribbon Commission. More than a third of beds are empty at Bellevue, Woodhull and Metropolitan, according to the same commission. 40% of beds are empty at Harlem Hospital and 53% are empty at North Central Bronx, which is literally across the street from Montefiore Medical Center. We're still an organization that is very inpatient-oriented, bricks-and-mortar-driven, Bresinoff said. That is a challenge but also an opportunity that is just unfolding. We need to identify how we should be going forward. We need to recognize what the needs of our patients are. We need to push very hard for appropriate levels of reimbursement for those kinds of activities. We're a bulwark in behavioral health. But the types of services health hospitals provides, including a bevy of mental health services, are typically paid at lower rates. Medicare, for example, pays roughly $10,000 for inpatient cirrhosis treatment if the patient has complications. A heart transplant is worth $1.2 million, according to a recent report from the New York State Nurses Association. All 5 major health systems in New York City, Northwell, Mount Sinai, NYU, New York Presbyterian and Montefiore offer heart transplants. Health Hospitals does not. Advocates for years have fantasized that the area's 5 large health systems would contribute, somehow, to health hospitals. The theory is that the public system takes the uninsured and under-reimbursed patients so that the private system doesn't have to, so it is only fair, they reason, that the other systems help shoulder the cost burden. The report from the New York State Nurses Association called for re-examining their tax-exempt status. Private hospital executives have said for years they do more than their fair share to care for the indigent. Fairness can be in the eyes of the beholder, Brezhnev said. I'd like to see them doing more in community behavioral health. I'd like to see them taking more of a share of the uninsured. Health hospitals just have some positive momentum that Mitch Katz, who is slated to take over at the beginning of 2018, can build upon. Approximately 75% of the system's Medicaid contracts are in a value-based payment model, which allow the system to reap financial rewards for keeping patients healthy. Moving away from a fee-for-service model, which never reimbursed health hospitals for the cost of the care it provided, has long been a goal and it may soon bear fruit. The system recently approved a 2-year contract with Huron Consulting Group, which promises to improve health hospitals' revenue collection and help it capture at least $130 million more each year. Huron, which has worked with several health systems across the country, including many in New York, believes it could help health hospitals collect as much as $740 million more over the next 3 years. But that won't be enough to save health hospitals, Brezhnev acknowledged. Absent public policy change, absent restructuring, absent improved reimbursement, all the trend lines are against it, he said.